paper really is about using AI responsibly in manuscript writing.
Good day, everyone. I'm Pablo Moreno Franco, the chair for critical care medicine at Mayo Clinic, Florida, and a co-author on the commentary article, Revolution or Peril, the controversial role of large language models in medical manuscript writing. And today, we're joined by Dr. Diaz Milian, my fellow co-author in this commentary. So Dr. Diaz Milian, would you mind introducing yourself?
Certainly, I'm delighted to be here, and I am a senior associate consultant for the Department of Critical Care Medicine and Anesthesiology for Mayo Clinic, Florida.
So what is the takeaway message of this article?
Our paper focuses on the role of large language models like ChatGPT in the process of medical writing. While this emergent technology has some ethical and practical concerns, we argue that it can greatly improve the efficiency and the accuracy in manuscript preparation, but that it should not replace human tasks like content creation and critical evaluation.
And could you briefly explain how large language models work?
Absolutely. These models use deep learning techniques to learn from vast amounts of data and they identify patterns and relationships within the language, and they generate text by statistically predicting what is the best next word based on the text. And they repeat this process until an endpoint is reached.
So maybe if you could highlight some of the major limitations of using large language models, particularly as it relates to medical writing, as outlined in your article.
Absolutely. The primary limitation revolves around potential inaccuracies of the text generated, in the risk of biases, concerns around authorship, which is a recent phenomenon, the possible creation of unfair advantages in economical unprivileged authors. And while these models, by the way that they work, do not plagiarize text, there is some misconception about plagiarism, and that needs to be clarified.
Very good. Then in the light of these limitations, could you elaborate on the benefits of integrating large language models into medical writing as presented in your paper?
Certainly. These models, we believe that the greatest potential is enhancing efficiency in medical writing because they can generate text very quickly. They free up medical writers to focus on tasks like refining the text generated, verifying the content of manuscripts. And also something that is very interesting is that these models excel at text editing, and that improves the clarity and the readability of the material. They can also assist with other research-related writing tasks, greatly improving productivity. They're also very valuable when text needs to be summarized, and they can be excellent grammatical correcting tools. Ultimately, this improves the readability of the text produced.
Yeah, that's really interesting. I mean, you could also conceptualize a world in which, some authors are using large language models to produce papers, and at the same time, then, physicians or clinicians are having to use large language models to then digest all the information that is being produced. So certainly a slippery slope. But, maybe switching gears, how do you think large language models could affect clinical practice?
Yes, so we believe that AI models like large language models, when they're used responsibly, they can enhance the efficiency of the entire clinical research process because they can aid in tasks like writing protocols, grant applications, and the reporting of research findings. This is ultimately will have a positive impact in clinical practice.
Very good. Then, given that patients may be hesitant or have reservations about the use of AI in different areas of medicine, including research, what does our commentary signify to the patients?
Yes, Patients might have some reservations regarding the use of AI in medicine, and that is known, and also in the role of producing manuscripts. And that's an important point to clarify. While we discuss in our commentary the potential of streamlining the writing process, we understand these concerns, and to a certain extent, we share these concerns. So we are advocating for a balanced approach that doesn't compromise the human element in the writing process. And we believe it's very, very important for authors to rely on peer-reviewed papers as source for their manuscript preparation.
Very good. So as we look into the future, what do you think are the next, steps that you envision for the application of large language models into medical writing?
So I believe that there's a great future for the use of these large language models, and it's important to continue to monitor how they're implemented and how they behave. It is also important for journals to establish consensus of what is allowed and to have clarity in the instructions of authors, sections of their journals. We're seeing that to a great extent on a lot of the journals now. We're also hoping that our commentary will streamline this process. Now, Dr. Moreno Franco, how do you envision the future of this technology at Mayo Clinic?
Yeah, certainly Mayo has, 150 years of history. So, in that regard, we're taking very seriously the concept of AI application into different areas of research, education, and clinical practice. Having conversations with some individuals that lead either Mayo Clinic platform or the Mayo Clinic AI factory, it is clear that there's research ongoing regarding the applications of AI itself, and also the application of large language models, particularly in ways to facilitate the day-to-day operations of our staff. And there's also, individuals within education that are looking as to how can we prepare better the future generations by giving them tools such as AI to apply, in the future. So I do think we're several steps away, honestly, from applying AI into clinical practice itself. But the future, it's bright and definitely very interesting. So we want to thank you, Dr. Diaz Milian, for this paper, and also for sharing your time and contribution with everyone. Thank you.
Thank you, Dr. Moreno Franco. It was a pleasure to discuss our work with you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.